You are doing everything right. You're eating well, you're moving your body, showing up your family, your work, and your life. And yet, something has shifted. Maybe it is the fatigue that does not go away no matter how much you sleep. Maybe it is the weight that crept on and will not respond to the same things that used to work. Maybe it is the brain fog, the joint stiffness, the afternoon crashes, the feeling of being 45 in a body you do not recognize. And the hardest part, you went to your doctor. They ran labs and they told you everything looks normal. I hear this every single week. Accomplished, intelligent people sitting across from me saying, I know something is wrong, I can feel it, but nobody can tell me what it is. And if that is you, I need you to hear something. You are not imagining it. Your body is not failing you, and this is just not aging. Something real is happening inside your body. Science can explain it, and more importantly, science shows us how to fix it. My name is Dr. Anna Handa. I'm a physician, board certified in internal medicine and lifestyle medicine. And this is CogniBios. Before I tell you about CogniBios, let me tell you why I built it. I spent years in traditional medicine, that is internal medicine, doing hospital rounds, 15 minutes appointments, prescription pads. I was trained to diagnose disease and manage it with medications. And I'm grateful for that training because it gave me a deep understanding of how body works. But I started noticing a pattern that my training did not prepare me for. Patient after patient in their late 30s, 50s, coming in with the same story: fatigue, weight gain, brain fog, sleep problems, anxiety, digestive issues. And when I ran their labs, most of them technically in the normal range. So the system told them, you are fine, come back if it gets worse. But they were not fine. They were in their early stages of metabolic dysfunction. Their bodies were sending warning signals that our standard lab panels are not designed to catch early enough. That gap between your labs are normal and you feel terrible is where millions of people are stuck right now. And it is the gap I decided to close. I pursued additional board certification in lifestyle medicine because the evidence is overwhelming. The same chronic diseases that are disabling and killing people can be prevented, treated, and in many cases reversed through how we eat, move, sleep, manage stress, and connect with each other. I'm also in my midlife. I understand these shifts firsthand. This is not the theory for me, it is personal. Let me share some numbers that should alarm every one of us. As of 2023, the CDC reports that 8 in 10 midlife adults, that is, adults between 35 and 64, have at least one chronic disease. More than half of the midlife adults are living with multiple chronic conditions. Nearly 4 in 10 American adults now meet the criteria of metabolic syndrome. Cluster of conditions including high blood pressure, high blood sugar, excess abdominal fat, and abnormal cholesterol. And among adults over 60, that number has risen to over 62%. You heard me right, 62%. That's a huge number. And here's is what most people don't even realize. Your body does not decline gradually and steadily as you age. A landmark Stanford study found that our biology undergoes two dramatic periods of molecular change. One is around 44, 45, and another around 60 years of age. In your mid-40s, there are significant shifts in how your body handles lipids, metabolizes alcohol, manages cardiovascular function, and maintains skin and muscle. This means midlife is not a slow fade. It is a turning point. What you do in your 40s and 50s determines the trajectory of your next 30 to 40 years of life. And metabolic syndrome is not just a collection of risk factors. Research published in Nature shows that metabolic syndrome literally accelerates biological aging. People with metabolic syndrome show epigenetic aging that is accelerated compared to those without it, independent of lifestyle factors like smoking or exercise. In other words, metabolic dysfunction is not just making you feel older, it is making your cells older. The good news: this is reversible. Now, here is why I get up every morning excited to do this work, because the same science that tells you how serious this is also tells you it is reversible. Let me walk you through what the evidence actually shows. The Diabetes Prevention Program, one of the largest clinical trials ever conducted, studied over 3,200 people at high risk for type 2 diabetes. The lifestyle intervention group, with modest changes in diet, 150 minutes of physical activity per week, reduces their risk of developing diabetes by 58%. Not with medication, but with food and movement. And that result was nearly twice as effective as the medication-only group. Dr. Dean Ornish and his team demonstrated in a randomized control trial published in JAMA that intensive lifestyle changes, a whole foods, plant-based diet, moderate exercise, stress management, and group support actually reverses coronary artery disease, not slowed it, but reversed it. Plaque regression after 1 year. Plaque regression after 1 year and even more reversal after 5 years, with 2.5 times fewer cardiac events compared to the control group. 2025 trial published in Nature Scientific Reports found that participants in therapeutic lifestyle program had nearly 4 times higher odds of metabolic syndrome resolution compared to the control group, with measurable improvements in their weight, their waist circumference, fasting glucose, cholesterol, and blood pressure in just 3 months. And the latest research from Harvard confirms that people with prediabetes who exercised just 150 minutes per week were more than 4 times as likely to return to normal blood sugar levels within 1 year. I want to be clear, this is not a fringe. This is not alternative medicine. This is published, peer-reviewed, replicated science from the most respected institutions in the world: Harvard, Stanford, JAMA, the New England Journal of Medicine. The question is not whether lifestyle change works. The question is, why it is not the first thing every doctor talks about? Cognibios exist because knowing the science is not enough. You need a system, you need guidance, and you need someone who understands what you are going through. This led platform built specifically for midlife adults who want to take control of their metabolic health, reverse chronic disease risk, and feel like themselves again. It is built on the 6 evidence-based pillars of lifestyle medicine. Number 1, whole food, plant-forward nutrition, not a crash diet, a sustainable way of eating that lowers inflammation, stabilizes blood sugar, and feeds your microbiome. Number 2, physical activity. No extreme exercise, but consistent, purposeful movement, including 150 minutes of moderate activity per week that trial after trial shows reverses metabolic dysfunction. Number 3, restorative sleep, because research shows that sleep deprivation alone can cause a 50 to 30% spike in fatty acids and pre-diabetic conditions even in healthy adults. Number 4, stress management. Chronic stress in midlife actually damages your cardiovascular system and accelerates cognitive decline and weakens your immune response. Fifth pillar is social connection. Loneliness is a health risk on par with smoking. The people around you and the quality of those relationships directly affects your biology. And last but not the least, number 6, avoidance of risky substances, alcohol, tobacco, and other drugs. Especially in midlife, when your body's ability to metabolize these is changing. When applied with the right structure and medical guidance, they are as powerful as and often more effective than medication alone. Here's what Cognibios offers you and what makes it different from watching random health videos or following generic advice. First, this YouTube channel, every episode is grounded in published, peer-reviewed evidence. No hype, no miracle cures, no supplements you need to buy. Just clear explanations of what is happening inside your body and what the research says you can do about it. Second, the Cognibios app. It is a tool I'm building to put real, actionable health intelligence in your hands. Snap a photo of your meal and see what is actually in it. Plain language explanations of what your macros mean and your progress across all 6 lifestyle pillars. You can schedule one-on-one consultation directly with me. And third, this is what matters most: physician-led guidance. I'm not an influencer. I'm not selling program. I'm a doctor who treats patients every day. And everything I share here is what I would tell you if you were sitting in my office. This channel is for you. If you feel like your body stopped cooperating, it is for you if your doctor told you everything is fine and you know it is not. It is for you if you're tired of being tired, if brain fog is affecting your work, if you're gaining weight despite doing everything you used to do, If sleep is broken, if your mood feels off, feel like a different person that you were 5 years ago. This is for you if you're worried about diabetes, heart disease, or any other chronic condition that you're watching your parents struggle with, and you want to do something about it now. And it is for you if you want answers rooted in science. No trends, no fads, just the truth about how your body is doing and what your body needs in this stage of life. In the episodes ahead, we are going to go deep. Here is the preview of what is coming. The midlife metabolism shift, why the way your body handles carbs, fats, proteins, it all changes after 40. What insulin resistance really means and what to do about it. Sleep and your metabolism, the direct connection between poor sleep, blood sugar spikes, and weight gain, and the evidence-based strategies that actually work. Food as medicine, what the research shows about nutrition patterns that prevent and reverse chronic disease, without deprivation, without extreme diets, movement that matters. Why 150 minutes of the right kind of activity per week can be more powerful than most medications for metabolic health. Every episode will give you signs you can trust and steps you can take. If you have made it this far, I want to say something directly to you. You are not broken. Your body is not betraying you. What you are experiencing is a metabolic transition that millions of people go through, that science understands and that can be addressed. The fact you are here watching this, looking for answers, tells me you are already the kind of person who takes ownership of their health. That is the hardest step, and you have already taken it. I'm Dr. Anna Handa. I build CogniBios for people exactly like you, and I'm going to walk alongside you through this. Subscribe so you do not miss the next episode. Turn on notifications, and if you know someone, a friend, a partner, a sibling who is going through what we talked about today, send them this video, because the first step to feeling better is understanding what is actually happening. I will see you in the next episode.